brow lifting. Great topic. Thank you for the recommendation. Let's take a beach walk. So, brow lifting is probably one of the most feared procedures in facial plastic surgery. It's the one where patients say, "Ooh, I don't know if I want to do that." And it stems from a long history of people that are overpulled or overdone and end up looking surprised, which is what nobody wants, because that is a dead giveaway that you've had something done. And so, in understanding brow lifts, it's important to understand what has to be done and how to do it well so that you can get a natural appearing result. So, brow lifting is a nice adjunct to a deep plane face and neck lift. Face and neck lift stops about at the lateral tail of your brow. We can't go much above there because if face starts getting pulled up beyond that, then there starts to become wrinkles. And in some people, if that lateral tail has fallen so much, you really have to do a little bit of a lift in order to give yourself space to fully lift the facial structure. So the brow lift can be a really nice adjuvant to the facelift. And the forehead and brow are not typically addressed in just an isolated face and neck lift alone. The point of a brow lift, or at least as we do it in modern times, is to release the ligamentous attachments around the orbital bone, or between the skin of the brow and the underlying bony structure. There are pretty tight ligamentous attachments there that hold things in place. And as we age, they droop and droop and droop more, and the brow area beneath the brow starts to get heavier. And patients notice that as just their eyes feeling a little bit smaller and having that heaviness feeling, or starting to get really deep forehead lines where they're trying to lift up their brows to combat the gravity that's pulling them down. There are many ways to go about releasing those ligaments, and more traditional approaches focused on skin removal, and they focused on pulling in all vectors. The original brow lifts were done in a bicoronal incision from the top of one ear to the top of the other. Extremely invasive, major approach. It's a neurosurgery approach. You can go in, you can access all of that, releasing everything, removing some skin, potentially pulling things up. That would always make the forehead higher. The trichophytic approach was developed, which is where you make the incision instead of in the middle of the hair, you make it right at the front of the hairline. That at least prevents you from raising the forehead any and may allow you to get a little bit of forehead reduction with it. The flip side is it leaves a scar, and if that scar goes across the midline, I think it's always visible, or at least becomes visible as you age and start to lose a little bit of hair. So that's where the endoscopic approaches come into play. And this is done through tiny little incisions in the scalp, usually with a small camera and tiny instrumentation that allows us to go in and release those tethered areas without making huge incisions that have the associated bigger recovery and usually more numbness. Endoscopic brow lifts, the original ones may have gotten a bit of a bad rap because of how we were thinking about them. We would go in and we would pull on things as hard as we could in all directions that we could, because pulling is better, right? But actually, in the last 10 years or so, we've realized that pulling in general makes things look unnatural. And so you need to release those ligaments and you need to reposition things, and you don't want any tension on them. So pulling in the medial brow, anything that raises the medial brow and separates those eyebrows, is what makes people look surprised. So avoiding tethering these eyebrows in the medial aspect too high is how you avoid getting that unnatural surprised look. My preferred approach now for doing brow lifting is a temporal brow lift. And that incision is just an approximately 1.5 centimeter, maybe 3/4 of an inch incision in the temporal hairline on either side. I don't trim any hair for this. It allows me to get in and access all those ligamentous attachments, fully release everything. And when you release it, you see on the table an immediate improvement. Once it's released, the brows naturally rise up to where they want to be. And as long as all those attachments are released, the brows are going to stay there. You just need them to get to heal where they're released to. And so there's some tethering sutures that are put in with a dissolvable suture up in the hairline that are anchored to your natural deeper structures, temporal fascia. And that holds everything into place for the 3 to 6 weeks that is needed for it to scar down where it needs to be. And that gives a really nice natural result. I'm not using any anchors in the medial brow that are pulling unnaturally the brows in an angle that they don't want to be. And this heals really nicely. This does not have associated numbness with it. This is very safe. And these scars are really hard to find by a month or two. So I think that the temporal brow lift is the current answer to how do we give a refreshed, natural appearance without making somebody look unnatural or distorted or surprised. So yes, so that is my take on brow lifting. I appreciate you coming on this beach walk with me on this lovely stormy day. And if you have any more questions, please leave them below in the comments. Thanks.